Thank you for staying tuned. Recall we brought you news regarding medical brain drain in the country, and to talk about that, we're joined by the President, Medical and Dental Consultants Association of Nigeria, and that's Professor Muhammad Mohammad. Good afternoon. Glad to have you join me on the news.
Good afternoon, and nice to be here.
All right, so let me kick off by asking you what factors have contributed to the declining number of medical consultants in Nigeria?
Well, we all know about the issue of migration. Humans are known to migrate, just like the way water flows along the slope. So likewise, in Nigeria, it is not limited to Nigeria alone, but it's something that we keep on informing and alerting the government so that we will not reach a critical stage where we will look for the apex of the suppliers or providers of medical services, and also the trainers of medical students in the undergraduate and the postgraduate, and doctors that are trying to be specialists in Nigeria. Some of the factors that are responsible, we all know in Nigeria how the economy is biting, and also likewise in any other sector. As humans, we always want to move where we can better our lives. But in the situation of the Nigerian consultants, there are still a lot of efforts being made by members to ensure that we maintain the significant number of consultants that are specialists, because they are the lifewire of the sustenance of medical practice and production of more doctors that are going to be with us. We all know that better working condition, better working environment, state-of-the-art facilities, and also the environment, safety of the environment itself, within the environment and within the hospital environment, and also outside within the society.
Just to chip in there,
some of these issues are part of what is making it more prominent now.
Professor Mohammad, you talked about economic factors. You also referenced better working conditions for the medical practitioners in Nigeria, being some of the factors responsible for their migration. But then how has this affected the delivery of service so far, particularly in the public hospitals?
Well, we all know that wherever the number of providers of services are not increasing, and also, in fact, gradually and unfortunately now progressively decreasing, it is adversely going to affect the services they render. In the sense that, for example, the long queues in the hospitals trying to see those that need to see specialists, and also the waiting time for procedures are some of the direct measures of the effect of migration. And you can all find out that the significant number of the populace may have to wait for some time to get effective service delivered to them, especially those that requires elective. We are still overstretching to ensure that all emergencies are handled so that we will reduce the suffering of the Nigerians.
Well, before now, we have seen different bills being raised by the House as a way to lure back, medical practitioners abroad. Do you think that can be, a silver bullet for this as a solution to this, brain drain we have? Or what do you think can be the long-term solution when it comes to retaining or attracting medical consultants in Nigeria or to Nigeria?
Yes, the solutions need to be divided into immediate and long term. We looked at the population of consultants, the number of consultants that are remaining in Nigeria as at last year. We have just a little over 6,200 consultants across the country. And we discovered that in the last 5 years, from the date that we conducted that study, about 1,300 have left in the last 5 years. And we also found out in that study that 1,700 plus are also going to, are already 55 years and above. So that means in the next 5 years, this group are also going to retire. So therefore, if you have equal number that have left in the last 5 years, living in the next 5 years, and also 1,700 are living in the next 5 years due to retirement, then if care is not taken, you are going to have significant drop, which will be about half. And we all know that in Nigeria, we produce between 150 to 200 consultants per annum. This production cannot keep up with the loss into retirement and also from migration. So we have been approaching government so that we can for now increase the number of the age of retirement so that these other categories of consultants that are likely going to leave service can continue to offer service, can continue to offer training, and can also continue to do research, because this is the most experienced category of consultants because they've been there. And when you measure, you find out that medical consultants usually start their primary job at around 32 to 35. That means if you allow them to retire at 60 years, that means they would have just offered service of 25 years, which is not equivalent to the investment the government has made in their education, and they have also made in order to better their service provision. So therefore, we've been urging the government to increase the retirement age for this category of people, which I want to sincerely appreciate the effort of the Honorable Minister of Health toward this. And I'm sure, God willing, very soon we will have a way out on this. And secondly, the bills that are coming in the National Assembly, we want to also commend Honorable Ola Ahmed, a member of the Federal House of Representatives from Lagos, for deeming it fit to bring a bill towards the increase in retirement age, not only for consultants, but for other healthcare workers. This will go a long way in retaining those that have decided to remain in Nigeria, and also they will continue to offer their services to Nigerians. This bill has passed second reading at the National Assembly, but what we are not too comfortable with is the prolonged delay in convening for the public hearing so that it can be assented to, passed and assented to. So we are urging the leadership of the National Assembly to give this bill a priority so that we can have, that means we are approaching the issue both ways. Whichever one that comes first will be greatly appreciated, and Nigerians will be better for it. Either the bill passed and sent it to by His Excellency, the President of the Federal Republic of Nigeria, or the effort being made by the Honorable Minister of Health so that we can have an executive passage and accelerated passage through the executive so that whichever way it is going to better the life of Nigerians and improve services.
That's a fine place to wrap it up. Thank you so much for your time on the news. President, Medical and Dental Consultants Association of Nigeria, Professor Muhammad Mohammad, many thanks indeed for your time.
Thank you very much. I'm happy to be here.